social anxiety, fear of negative evaluation. That's really what social anxiety is about. And there are two versions of this. There is very highly situation specific, which typically is public speaking anxiety, and then there is more pervasive social anxiety. And social anxiety disorder is the third most common psychiatric disorder. And in my career, and I think this is true for other people, many people that come in for therapy who have social anxiety disorder don't come in primarily for the anxiety disorder. They come in for major depression. And the reason they come in is because of their social anxiety, their life is not good. Many people have incapacitating, crippling social anxiety, never develop intimate relationships. And so they're lonely. Many people have very severe social anxiety. They may have the ambition, they may have the IQ points, they may have all that it takes to get ahead in whatever profession, but they're shy, they don't assert themselves, they don't ask for raises, they don't volunteer, stuff. And so a lot of these people come in and they know they're far beneath their capability in terms of occupational success, and so depression. So frequently, that's kind of their ticket in the door, but the cause of that is a social anxiety disorder. So let's talk about public speaking anxiety. And here it's one thing if somebody takes on a job and they're going to have to do a lot of public speaking. Okay, they need either to see a psychotherapist, which I recommend, or think about drugs in terms of SSRI. But people that have to do it just every now and then can take a beta blocker, like we talked about before. And Gallup poll a few years ago showed that the number one fear among Americans is public speaking. And to put this in perspective, number 7 on the list was the fear of death. So there are lots of people that feel very uneasy about getting up and giving a talk in front of a group of people. Are you afraid that they're going to hurt you? No. What are you afraid of? Afraid of being embarrassed. Afraid of making a fool of yourself, right? Anybody ever been there? Yeah, sure. And me too. And I teach all the time now, so I got beyond that. But I remember the first time I had to give a talk, I had just done a little bit of teaching, but I had to give like a 15-minute talk at this meeting, but it had 1,200 people. And it's like, and I felt this is more, probably 25 years ago. So I was feeling really nervous about this because I didn't want to look like a fool, embarrass myself. So anyway, I went to my primary care doctor and I said, I got to get up and give this talk, and could I have some drugs? And he goes, oh yeah, sure, here. Reached in his pocket. Not quite. But he said, I'm going to give you a prescription for beta blockers. And Inderol probably is the one that's used the most. And you take it, the dosing on that, you have to play around with it a little bit before you get up to give your talk. Now, it lowers, these drugs are approved for treating high blood pressure, so if you take too much, then your blood pressure drops, and then you go to give your talk, and you stand up, get lightheaded, and faint. That's not too cool. Okay, so he said what he did is he said the typical dose is 20 milligrams. Take it an hour and a half before you talk, but take it the weekend before, and wait about an hour or two, and then get up and down several times and see if you get lightheaded. And I didn't, so I went ahead and worked. Now, what I did, but I want to tell you about this because this is very interesting. Okay, so I went to this thing that's down in San Francisco. It's a huge group of people out there, and I took my drug, and I wasn't dizzy or anything like that. But prior to getting up to give my talk, all this catastrophic stuff was going through my mind, like, oh my God, look at all those people. I'm going to make a fool of myself and all that kind of stuff. But I got up there, and it's like my body is perfectly calm. It's like, oh. It felt weird because, the thing is, I know ever since I was a little kid, if I felt nervous or if I thought nervous or I was afraid, I would feel nervous. And my body's like, hey, I'm okay. And, there wasn't this trembling, and I wasn't sweating, and I wasn't having, tachycardia and that kind of stuff. So it didn't have any impact on this, oh my God, look at all those people, but it calmed me down enough that I was able to do that. And so that was my one and only time that I took a beta blocker. But lots of medical students, they take beta blockers, when they have to do a presentation or something, because if you use it just every now and then, and you don't get low blood pressure, then it's not a problem. But here's the but. If you use beta blockers chronically to treat anxiety, it has a high rate, well, relatively high rate of causing major depression. The statistic is 8%. Okay, 8% of people that chronically take beta blockers develop full-blown depression. And I've seen one or maybe two people in my career that came in with full-blown severe major depression, and sure enough, they were not being treated for hypertension, they were being treated for generalized anxiety with beta blockers, got them off the beta blockers, and the depression goes away. So this is for occasional use. Okay. Now, social anxiety disorder, you can use any of the antidepressants, but if you look in the literature, it'll say that the most effective treatment, medical treatment for social anxiety disorder are MAO inhibitors. And I want to tell you, I just want to tell you a clinical vignette. This is when I was working at Kaiser. And if you look at social anxiety disorder, you kind of move down towards the end of the spectrum of increasing severity. And at some point, it really begins to merge into avoidant personality disorder. I'm going to tell you a story, and I'm not making this up. Okay, this guy came to see me. At this time, we had 10 sessions at Kaiser that we could offer patients, and then if they had major mental illness, we could, try to make a compelling case to double that. But we were forced to see people in very short-term therapy. So this guy came in to see me, and this guy, he looked like a little mouse, and he's kind of skinny and shy, and he came in, he wouldn't make any eye contact, and he's real nervous. And so I asked him how come he was there, and he said, well, my wife told me if I don't come and get some help that she's going to leave me. Now, it's always been a mystery to me how this guy ever got married, okay, but he had extremely severe social anxiety, such that he was afraid to go. At first I wondered if he was paranoid, but he wasn't. He wouldn't go out during the daytime because people would look at him in the car and he'd feel so self-conscious that he'd get really, really anxious. So he had a nighttime job. He worked doing data entry in an office at the night shift, and there was only one other person working there, probably another person that has social anxiety disorder. Okay, they had not gone on vacations. They don't go out to eat. He won't go shopping. And at some point, his wife said, "The heck with this! This is no life." This guy was crippled. I mean, he could work, but then he had to hide out at home all the time. And so it's like, oh, geez, okay, I've got, 10 sessions with this guy? Oh, yeah, right. Thank you very much. I don't think brief therapy is going to work here. So what I said to him is I said, listen, I'm going to tell you, this was at the end of the first session, I want to tell you that the kind of problems you're talking about, since they're very long-standing, I think it's unlikely that 10 sessions of therapy are going to really address this. And so I want to tell you, I think you have two options. One is to go see a therapist outside of Kaiser that you can see for a longer period of time. The other is to try medication treatment. And he says, I'll try anything because my wife is going to leave me. I say, okay. Well, so he opted for the medication. And so the psychiatrist there, I talked to him, and he and I talked about cases all the time. And so I said, what do you think about trying an MAO inhibitor with this guy? And he goes, yeah, sure, let's do it. At least in the literature it says that that's really the most effective. So he put him on an MAO inhibitor, and this was the Kaiser way back in those days. I'd see people every 2 weeks. Okay, so he started on an MAO inhibitor first visit, came back in 2 weeks later, and he walks in there, and he looks like he's a different guy. He makes eye contact with me. His gait is not sort of timid kind of thing. It's more kind of assertive, really walking in there. And I said, how are you doing? He goes, I'm doing good. He said, I got this medicine as of like 2 or 3 days ago. I really started feeling different. And for the first time, I think in my life, I think I feel normal. Now, the first thing that came to my mind is, this guy manic? No, seriously. I mean, it was early in treatment, but it was such a radical change. And so, but he didn't have decreased need for sleep. He didn't have pressured speech, that kind of stuff. And I go, wow. And so anyway, he came in, and he was just saying this is a godsend, and onset of action had been about 10 days. Okay, so I thought, holy mackerel, the books are right. So he came in week after week, and he continued to report that his whole life had changed. And he started going out to restaurants, and they went out to Lake Tahoe for a weekend or something. But something happened, okay? About the fourth or fifth week he came in, he started talking to me about stuff that got me concerned. And that is what he was doing, is he was going out during the day and going to bars and hitting on women, and they were telling him to go jump in a lake, but they didn't exactly use those words, okay? But what was really clear to me is he was significantly disinhibited, but this guy who'd had this problem his whole life had no social skills. And he was, again, he wasn't manic, but he felt a sense of aliveness because it's like he'd been let out of jail for the first time in his life. But he was going in and being really inappropriate with strangers, like hitting on these women in the grocery store and stuff like that, and they were like, I don't know if they actually slapped him, but they told him to, buzz off, buddy, and stuff like that. And so, okay, we'll see what happens. Anyway, he comes in like the next week and he says, I got to get off this medicine. And I go, okay, sure, but how come? And he says, my wife told me, we're out and I'm coming on with these women, and she's there with me. And she said, listen, man, you got to get off this medicine or I'm going to divorce you. And so anyway, I said, well, okay, been on it now for, 2 months? And so cut the dose in half and I'll see you in 2 weeks. Came back 2 weeks later, little mousy guy again, I saw him for 2 more sessions, and I gave him the name of an outside therapist, and I never saw him again. So, but now that's not, that you're not going to see that every time, but that, for me, that was just this really pronounced case of an antidepressant like that working in almost miraculous ways. The truth is, most of the time, the degree of improvement on antidepressants is modest at best. But it reduces some of the social anxiety, which then enables people to start doing what? Stretching their comfort zone, going out and doing more stuff. And sometimes you need to take the edge off the anxiety to really get people to do some of the exposure work. Okay. Public speaking anxiety. Okay, SSRIs, 50 to 60% of people have a 50% symptom reduction. So that's what I mean by modest effect. Now that doesn't look great, but when it works this way, those half or 2/3 of people that have 50% reduction, it matters. They say, yeah, I'm not totally okay, but gosh, I'm doing a lot more than I used to. My life's better. Okay, so it can be very helpful.